to the Tapestry of Life on CCP TV, the educational channel of Community College of Philadelphia. I am Dr. Pascal Scoles, Professor of Behavioral Health and Human Services. Today's topic is trauma-informed holistic health. In Philadelphia, St. Elizabeth Wellness Center is a collaboration among Project Home, Women Against Abuse, and other partners that provide holistic, integrated wellness services, including medical and trauma-informed behavioral health therapy in a low-income neighborhoods that experiences domestic violence at a level twice the city average. My guests today are Renee, a survivor of domestic violence, who will speak directly to the impact and symptoms of trauma, Nathalie Han, Woman Against Abuse Shelter Behavioral Health Supervisor, and Lucy Kibe, Project Home Director of Clinical Services. Welcome to the show.
Thank you.
I wanted to get started by maybe asking one of the clinical people to kind of start. Maybe we can start with.
So, like you said, Nathalie from Women Against Abuse. I'm the Behavioral Health Program Supervisor, and what we do at Women Against Abuse is we offer, we're one of the largest domestic violence agencies in the country, and we offer comprehensive services. We offer emergency shelter, transitional housing, legal support, advocacy within the city for domestic violence, and of course trauma-informed behavioral health care. And we are in this collaboration with Project Home and other organizations, really trying to bring in trauma-informed behavioral health care to an organization.
To Project Home.
To Project Home, to the area that is needing the support.
How long did it start? I mean, when did you start collaborating with each other on this holistic approach?
So you want to take this?
Yeah, it's been this is our third year for this collaboration, and Project Home is the umbrella organization, and the H stands for housing.
Mm-hmm.
Our goal is to empower adults and families in Philadelphia to break the cycle of homelessness and poverty, and to help them to become part of the society like everybody else. The O in home is opportunity for employment, and the M is the medical. We have a medical clinic for primary care and behavioral health, where we partner with Women Against Abuse and Council for Relationships to bring this integrated holistic health care among individuals in our neighborhood, most of whom are very poor and disadvantaged. And the E in the home is education.
Yeah. I'm familiar with actually both of your organizations because one, Project Home is only about a block or two from the college, and you know, your executive director is on the mayor's commission with me, so. And you both do wonderful work. I mean, I know this from this, so it's interesting that two organizations that have a wonderful history of working in the community are now collaborating on developing a more holistic approach to dealing with. I guess more agencies in the city should be doing that, I assume.
Yeah, you know, it's wonderful to see. I went through, as a survivor of domestic violence, I went through domestic violence when Women Against Abuse was just starting out. Oh. So when they started out, it was a shelter. There was no legal services. All these things are available now. So even though for me it's been 35 years, it's been over 35 years, it still warms my heart to see domestic violence coming from out of the shadows, and seeing for every initiative that's out there, 35 some years later, you would think, oh, you know, it's fine, it doesn't impact me, but it still impacts me today.
Renee, when you look at the collaboration that's going on, which I think is an important collaboration, from when you started in the trauma issue, there were just a couple services, it sounded like.
Right. There was the shelter. I mean, and there were services within the shelter. I remember going in the shelter, and I look back at the shelter and just remember just this army of women coming. And it probably wasn't an army because they were a small nonprofit, but it was, what do you need? How can we help you? you know, you need help with housing or food or childcare or whatever it is, you know, someone was there to help point you in the right direction and get you through that. So it's come a long way. I mean, when I stayed through, I think the time frame was maybe a week. You know, and at some point I went through a marriage for 7 years. I might have went to 2 weeks. So now I think it's like 6 months or something.
60 to 90 days, yeah.
60 to 90 days. To me, that's like a
At
lifetime.
the emergency shelter, yeah.
At the emergency shelter, so.
And I assume based on experience, it expanded because of the services that were needed.
Right, and I was going to say that that's exactly, I think stories, you know, survivors that we've worked with, that's how we've evolved into offering all these different services. We saw a need, we see a need, and we go for it, and we try. And you know, Women Against Abuse, part of our mission is to really be responding to some of the needs of the community. So we're always trying to check, which is exactly why we started the St. Elizabeth's collaboration. We worked in them because we did see a need in this area, in the area that we're located, that, as you mentioned, that domestic violence is a rate twice as high as the city average. So we really saw, okay, this is where we need to be providing this behavioral health care in collaboration with the medical care, because so often those two things go hand in hand, and that it was a need, and we saw it, and we went to try and provide those services.
Kind of populations, when you say someone comes through the door, what is unique about, and I'll ask Renee eventually to tell her story, as we say in the field, tell a story, but I'm kind of curious as to what makes the wellness issue more significant in relation to the people coming through the door. I mean, it seems, I mean, I understand it's a natural evolution to patient or client first experiences, and then you build a program around the experiences of the clients. But I'm wondering what happened? How did it? Who do you see? I mean, I know, and you know. And I don't know if the audience knows, because some of them are. So in a sense, what happens here is that some of the information that you'll talk about, the populations of people that come through the door, will sensitize people in the audience to come through the door. I mean, that's one of the issues. So maybe you can talk a little bit about the flow of.
Yeah. So our physical health is very much related to mental health. It is the same body. So somebody experiencing mental health will also experience certain physical problems on their body. An example would be a patient that comes into the clinic and their blood pressure is high. One of the benefits of having this integrated care that we have is I can see that patient, see their blood pressure is high. I could prescribe medication, and I could say, okay, you need to try and eat less salt to lower your blood pressure, and try to reduce stress in your life. Or I could have them go out the door and figure out how to do that. But in our collaboration, what I would do is I would give them a prescription, but I would also refer them internally to a therapist from Women Against Abuse and do a warm handoff. Talk to our therapist and say, this is Miss Jones, her blood pressure is high today. She mentioned a few stressors in her life. Could you please talk to her and help her with that? We also have a sister who does holistic health called Healing Touch, which helps to reduce stress. I can do a warm referral again to her. We have a nurse who does nutrition counseling. I can do a warm handoff to her. So all these happens in the same location with all the providers talking to each other and providing this continuum of care over a period of time to help these patients to reach their goals.
Is your background in, I guess, medical?
Yes, I'm a physician assistant.
You're a physician
assistant.
Oh, you're a physician assistant. You know, it's interesting to talk about touch, which actually does come out of a lot of the experiences of the nursing profession and physician assistant profession. And can you explain a little bit about that, or do you not that familiar with it? I don't know what they mean by that.
So a lot of the people we see have probably, if they have gone through some kind of abuse or domestic violence, have been touched inappropriately, and they're afraid of that. But this technique provides an opportunity to align the energies of the body. It is holistic, And it's very light touch in different parts of the body that provides a relaxation to the body. And we have people that come every week, and we have evidence of people's blood pressure falling, of people feeling better, and attesting to the benefits of this healing touch. We're also starting a yoga class soon, and massage therapy within the clinic, which we provided to all our patients for free.
You know, I'm not familiar with that program, but I can say, as someone who went through a horrific period in my life with domestic violence, even in my current relationship, anyone that knows me knows, don't make any sudden movements. If we're arguing, don't ever touch me, even to say, you know. So there is a lot of stress that still happens, and it's been 35 years, and the closer I was to that period, like when I first got out, it was more traumatic. I have tried yoga, but it's still something about the human touch. Probably took me a couple of years not to flinch if someone moved too fast. So I can see, well, that will be very helpful.
Well, I didn't really think about it until you started mentioning it, but you know, I mentioned earlier before we went on that I see a massage therapist now because of some condition of my arthritis, but I didn't realize that how effective maybe something like massage could be, because it does involve a lot of touching and removing, you know, trauma, so to speak, from your body. It does seem to have that kind of a component to it. So if you're having difficulty, even people touching your hand, that's almost like you're being saturated with the love of massage, so to speak. And it could be quite helpful in desensitizing you to some of those issues. So it sounds like the holistic program, at least one of the components that it brings that maybe was not around in an earlier point in the development of the program for trauma, was the whole thought of alternative medicine as an option for healing. And it's very...
And I think that your experience is very common in survivors, in the hypervigilance of sudden movements, and the impact of trauma. And there's a lot of studies going on now that the impact of trauma on our physical body, and you know that it is all related. And I think that that's why, you know, in a traditional medical clinic, you know, you may not have gotten the referral, you may not have gotten all these other services, you just given the prescription and, you know, you're sent on your way. And I think that with more awareness, which is one of the things that we really try and have in this collaboration, is a lot of emphasis on talking about trauma-informed care and what does that mean, and having more sensitivity to the history of somebody coming in. You know, one of the ways that, you know, to be trauma-informed is to assume everyone who walks in the door when you're seeing someone professionally that they've had trauma, and just act as if, and to make sure to not re-trigger someone. You know, I know that that's happened a couple times, that somebody's re-triggered in a medical setting, and in a traditional medical setting it might have been seen one way, but at, you know, in a collaboration, at St. Elizabeth's, for example, you know, you look at it and you say, okay, well, what has happened to this person, and what has brought this reaction onto me, into this setting. And of course then there's the behavioral health person right there right away that can help. Hopefully they've already had a relationship. Everybody is treated, you know, like you mentioned, what is the difference when somebody comes in is that when you come in you feel welcome, and you know everybody that's there. They call you by name. You know, little things like that are so important that we try and do everywhere. You know,
I want to say that I think I mentioned a little when we were off camera that I have arthritis in my knees. That's probably maybe 2 or 3 years old, and I was seeing ortho. Ortho at my doctor's office is just fabulous. And so we went through, initially I was there with someone else, and I said, you know, my knees have been hurting. He said, well, hop up on the table, I'll look at him. He said, you know, there's something going on. So we'll start a series of tests with x-rays. We went through MRIs and all the different tests they do with your knees. And each visit, he kept saying, Renee, so what happened? Were you looking at these medical records, and it looks like that you were in a really bad accident. You know, you have to tell me what's going on. And I would say, I'm a survivor of domestic violence. I spent 7 years in a horrific relationship. No, that's not it. So they would do the next round of tests and the next round of tests. And each time he would say, Renee, as your doctor, you've got to tell me. Maybe you were little, ask your parents, maybe you were in a horrible accident and you just don't remember. Because your knees are just, this is beyond arthritis. They're really destroyed. I mean, you're looking at, right now you're even too young to get both of your knees replaced, but that's where we're at. And I would say, I was in a domestic violence relationship. It was really brutal. No, that can't be it. Renee, you got it. And then finally I said, okay, my ex-husband is currently in jail, not for anything he did to me. He's in jail for chopping up his mother with an axe. So I spent 7 years in that relationship, and all of a sudden I saw the light bulb go off. And he said, well, that would mean that he would have to have brutally attacked you with something hard like a bat or something. And I'm going, welcome to my life. I've been saying domestic violence, and this was maybe over 6 weeks of all these tests, and he was just dumbfounded that, and I'm looking at him going, what did you think domestic violence was? What did you think that it was that he just kept, and it wasn't in a way that upset me, but I saw that he wasn't really taking the seriousness of how bad domestic violence can be, because he kept probing me, but it took me back, and this was just 2 or 3 years ago, that my knees are pretty much destroyed based on what happened 35 years ago in my life. And as I get older and as I mature, more and more things start to come up with, oh, no, well, that came from this or that came from that. Where before it took probably a couple of decades for all the physical scarring to go away. And now as I mature, it's starting to come out in other ways. But I found that in traditional medical settings, I don't care how fabulous they are, they're just not that informed with kind of the things that happen with domestic violence. Going to the shelter, I remember the first time I went to a shelter, it was, wow, there's more people. Because there's a big shame comes with domestic violence, kind of like it does rape. I lost, to jump ahead a little bit, I lost my sister in a domestic violence incident in 1999 in a murder-suicide. He killed her, killed herself. My niece I just brought to the domestic violence walk that just happened a couple of months ago, and right after we left, she said, oh my God, that felt so wonderful, because I'm finally around people who understand, because people were there with their mothers or their sisters, their pictures on t-shirts, and it's taken me all these years to get her to come out. And she had been texting me ever since she left there going, I want to volunteer, I want to get involved. It felt like I went someplace that was home and familiar, because no one judged me and everyone there understood. So it's almost like this society, and that's the way you feel when you go into, I think you alluded to earlier, when you go into a shelter, when you go into that community, that the shame is gone and they're there to empower you.
Yeah. Well, you know, and we have a medical person here, which is interesting as a physician assistant, is that what gets me is almost the lack of information from the medical side of the equation about attributing some of your physical experiences, relating it back to a trauma that you had earlier in your life.
Right.
So I'm always shocked at that, and I remember in my own experiences that when I took a couple courses in the medical school at university, I remember that the only thing they taught there was the end product of addiction, cirrhosis of the liver. And so you wonder, in your experience as a physician assistant, how did you come about a better appreciation for the physical, psychological? We haven't even talked about the spiritual stuff, which maybe we'll get a little bit into today. That's another area that I don't mind speaking to if we could. But I wonder, how did you come around to finding it, before we go back to maybe Renee and ask her some other issues?
Well, I was fortunate to go to a very good PA program, Hanneman, which does include some of holistic care into the medical training, and the focus there is primary care. But I have to say it's still not enough, and most of what I have learned on the job, and working in a place where this is embraced very heavily. There's a lot more that could be done, and there's a lot of information online on trauma-informed care, and we encourage our staff to read on it. We train them so that everybody in our clinic, whether it's the medical assistant or the receptionist or the nurse or the physicians that we have that come from Jefferson Family Medicine, they look at all our patients in those eyes. And we know that the area that we serve, there's a lot of violence and all kind of trauma that everybody that walks through our door has gone through, more than people in the general population. For example, an interesting statistic is that the area that we serve, the zip code 19121 and 19132, compared to the city of Philadelphia, if two boys were born today, one was from anywhere in the city of Philadelphia, and the other one was from our zip code, the one from the city of Philadelphia in general has a life expectancy of 72 years, male. But from our zip code, still within the city of Philadelphia, is 65 years. They have this access to the same health care. They have access to health centers. They have access to Medicaid and Medicare. But there's that difference. So we understand that the population that we serve is very disadvantaged. And so we have to look at our patients in a different way and be very sensitive to what they may be going through based on the environment that they live in. So all our staff are trained and are encouraged to look at people in that way. So we don't ask people if they're not compliant with what we ask them to do. We don't ask them, what is wrong with you? Instead, we say, what happened and how can we help you? Because we know there's a lot of other issues surrounding their lives compared to other people.
Are you familiar? Just let me ask this question. Since people are somewhat familiar with zip codes because of the post office, generally what areas are those two zip codes?
It is
in?
North Philadelphia.
North Philadelphia.
North Philadelphia.
That's where I grew up, North Philadelphia. Well, I'm 71, so I'm okay. I got past this early 60s story. But I grew up at 22nd in Indiana, and I assume that's that zip code. I think it was 19128 or 9, if I'm not mistaken.
Close, yes.
And so it's the environment. So what you're saying is that it's not only the physical experience, but it's the environmental experience, which has an impact on the psychological experience, which has an impact on the social and cultural experience.
Exactly.
That can reduce your life expectancy.
Right,
At least
right.
In some we don't know exactly how it works, but we do know that environment is an important player.
Right, and it is not just
makes sense.
life expectancy and mortality, it's also morbidity and quality of life. Although the people in our neighborhood have access to health care, when we do surveys, Philadelphia Health Management Corporation did a survey a couple years ago, and people in our neighborhood have access to health care through the health centers and other physician offices. But when they looked at the reports of their health, they reported to have poorer health compared to the rest of Philadelphia. They had higher rates of hypertension and diabetes. They had they were less likely to get a mammogram or a pap smear or a prostate exam, and so we cannot understand fully why that is the case. But when we come into our clinic, we are aware of that, and so we try to address those issues a lot more.
I think that's really important, and I think that's what keeps me going back to Women Against Abuse. In addition to being a survivor, I'm a community awareness rep for them, so I go out into the community, and depending on the community I go to, sometimes they accept, and other times they just, nope, doesn't happen here. And I say 1 in 3, there's 50 people in this room, 1 in 3 women, this many women, and I get, nope, not happening here. So I think to be able to look at that environmental piece, and to tie it back to Women Against Abuse, because that's always my platform. But to be able to look at that and see here are the correlations that kind of happen here, and this is what this population is looking at. That goes back to the story about my doctor and my knees. I think that needs to be more mainstream in medical, that they're looking, and I think Dr. Scoles, you mentioned that they know my history. I mean, anybody that knows me knows my history because I tell my story walking. But to be able to think, okay, something with the knees, did that go back to this, or, you know, what's happening, and it's not happening enough. It's definitely not happening enough. And for domestic violence, unlike your organization, it covers every social economic group out there. Yeah, I don't care where you live at. So you don't just have to be poor. It covers everybody. But I think 35 years later, I'm still in therapy. It affects my interpersonal relationships. I'm just starting to hear, after millions of time, of my adult daughter and my partner saying, you really do live by a never again. And I live by a never again. I'm never going to go through. The breaking that cycle of domestic violence stops with me, but it gets in the way of
life experiences.
Life experiences.
Yeah,
I mean,
sure.
I've come a long way. I started off as leaving home at 16 because I knew everything, as every 16-year-old does.
Were you originally Philadelphia?
Originally from Philadelphia, middle-class family. Left home. My mother died when I was like 13, 14 years old. Left home at 16.
Okay.
With child. I was pregnant. Met my husband a year later. Was a high school dropout. But I've turned it around. I've spent 7 years in there. I'm currently working on my PhD. You know, my daughter does have a college education, but
how did you survive that? Because we talk about in the field, you know, I mean, I don't mean to keep interrupting, but we talk about resilience and transformative issues, and the city talks about it a lot. The program that I'm involved in right now talks about it a lot, and your story, and I had an opportunity to look at your story because you had sent me, you know, or someone from, and what comes across in your story, and I think the audience would love to hear more of your story, is that you, throughout all of that experience, you developed a real resilience to life and made the transition, even though, you know, you're still struggling, and we all struggle with, you know, things that happen to us, but you seem to have turned it and moved it in the traditional way we call being resilient. It's a hell of a preface to get me to talk about.
No, it is. Women Against Abuse is my hero.
Okay.
You know, they are my Harriet Tubman. They call and say, Renee, can you do? To me, it's my elderly parents, because they were there to get me through.
Okay.
They are all about empowering women. So they never talked bad about my ex-husband or your partner, whoever it is what do you need? How can we help? What do you need to do? And they're all about empowering women. So I do a lot of speaking and telling my story, and folks go, well, you don't seem like you're a victim. Oh, this Renee is not a victim.
Yeah, that's right. That's the resilience component.
The Renee back then was a very meek and introverted, shy person. And it was that empowerment. I mean, I tell people all the time now, I get questions to say, my friend, my cousin, or what do I do? And I say, call the hotline number, because that's what they're there for. They got me through the hardest part, just having that number that you can call, even though sometimes you call and there's no space.
In the facility.
In the facility.
Yeah, that's true.
You have to go back in there, but it's that person that you can call, it's the secret number that you can call. And there's someone there. There's someone there to talk you through and to give you that oomph to survive. I'm probably not a crier. I know I'm not a crier today because I spent too much time sitting in the corner and crying and weeping at all the horrible things that were happening to me. You didn't discuss domestic violence. I remember running into a friend that I hadn't seen in a while, downtown, 13th and Market, and she said, oh my God, how are you? What's going on? And I said, you know, I'm good. I'm staying in a shelter. And it was, shh, don't tell anybody that. You don't tell anyone. There's 7 kids in my family. I am number 6, all girls, 1 boy. My sisters, some of my sisters are 3 years older, 7 years older, 18, 19, and 20. So when I went to family, it wasn't like I'm going to siblings my age. I'm going to adults. And I was told, do what you think is best. Obviously, I'm not too good at that right now. Dropped out of high school. I'm not at home. I have a child. Obviously, I've not been making the best decisions, so I probably shouldn't be told, do what I think is best. I went to my father, who was my hero. I was youngest daughter. To hear my siblings tell it I was the favorite child. I went to my father in the middle of this abuse. I've had the black eyes, the dislocated hip bones, the fractured cheekbones, all of it, and said, I don't know what to do. I can't take this anymore. And he looked at me in my face and said, what did you think marriage was? So number one question that I get over the years through today is, why did you stay? Mm-hmm. Well, there weren't any PSAs back then. There were no PSAs. Women Against Abuse was a grassroots organization.
That was struggling at that time.
Right, they were struggling. So it was a baby.org, you know. So there was no one. I couldn't go to family. I would go to my sister's houses for dinner, and, you know, I understand you're going through a hard time and you're staying at that shelter place. Come over for dinner, and I would get there, and there's an extra plate at the table. He called us crying. So we invited him over. You guys need to get back together. So, sorry, I got off track there.
No, that's okay. But in other words, they didn't even know what to do, even with you as their blood relative.
Right.
And they go and invite the person who you're trying to get away from to the dinner.
Right.
Wow.
And people don't realize that the most dangerous time for a woman is when she's leaving. Most of the big cases that you hear in the media is the woman's left. She probably has a PFA, a protection from abuse order. My sister, when she was killed, she had a protection from abuse order. There was a warrant out for his arrest. She was killed. So it's a very dangerous time. So it really is deadly. And like my doctor just thought it was, you know, that can't be it. Your knees can't be messed up because of domestic violence. So I know you asked me a question, and I went way over there.
Well, that's okay. No, I think we were just trying to recount some of the history and try to relate the transition that you made into becoming a more resilient person, and how, if these new services were available at that time, which is this whole new evolution of services between this collaborative effect thing that's going on, that I wonder how, in retrospect, thinking about, would it have made your life easier to make a transition in, because there was more diversity of experience and collaboration going on?
For sure. I mean, just some of the services now that are available, there's legal services available, and there's transitional housing afterwards. I mean, back then, you might have stayed a week or 2 weeks, and what I ask people is, if you had to leave your house today, right now, with what you have on your body, you no longer have access to your bank account because they've taken the money out. You're afraid to go to your job. You don't have access to your car. It's kind of like a stalker.
Sure.
Where would you go, and how would you stay safe if you had to leave right now today? You know, December the 5th. Right now you left here, and all of a sudden it's like, I can't take any more, I'm out. Where would you go? And how would you start your life over? Women Against Abuse was someone that was there every step of the way. At some point it got so bad that I called in, and at that point I was at a first name basis. Hey Bernice, it's Renee. I need to come in. And I said, I have to get out of here. I have to get out of here. And she said, where do you want to go? And I said, I got to get out of state. I'm no longer safe. I mean, I'm afraid for my life. And she said, we have networks all over the country. And they got me 1,600 miles away to a shelter in Texas.
Oh, really?
You know, and this was in '79.
So the networking is real important too.
Absolutely, and I think that helps. You know, that we are one of the largest in the country, because we do advocate, we do try to work with other states, and especially if somebody is at the shelter and they have been followed, they've been found, we will relocate them. We have, we relocate people all the time. And I did actually want to say that we've now have a 100-bed shelter, but we are expanding to a second shelter.
That was a new, if I'm not mistaken, that was a relatively recent development.
Absolutely, yes, because I mean, last year alone, we turned away 9,000 calls from the phone, from the hotline. And it's really difficult. It's really difficult to have that.
And most people don't know that. When I go out speaking now, my new question is, how many shelters do you think? Philadelphia has 1.5 million people. How many shelters? And folks go, 22, 44, so I don't know where they come up with these numbers. 17, and I go, 1, and they go, 1? Yeah. They're shocked to hear that there's 1, and I said, and there's 100 beds. And half of those are for children, and they're looking at me like, no, they're everywhere, and the people are shocked to know that there's 1 shelter.
Well, what I didn't realize, even in this discussion now, was that you have all these other connections in other states. I don't know why. I mean, someone with my background, you'd think I would know more of this. But for some reason, I didn't know there was all these other like vehicles that you could move them into Texas or Illinois
Absolutely.
or Michigan or wherever. And that's a wonderful thought because you truly are far away.
Yeah.
If you know
Yeah,
what I mean.
and
from
I
the
had no
assault.
clue it was
Absolutely.
available. I called and she said, "Where do you want to go?" And I'm going, I've been Philly, New York, you know, the tri-state area. Hold on, I'll call you right back. Dad, I'm leaving the state. He said, "Go someplace with a good economy." I said, "Okay." I said, "Where?" He said, "Texas or Georgia, Atlanta at the time, were boomtown, Houston and Atlanta." I called back and said, "Houston." She said, "All right, come on in. We'll make some phone calls." And in 48 hours, I was 1,600 miles away.
And that has a lot of psychological relief, I assume.
It does.
Yeah.
It does. I was probably, and I had been through the process. Every time you go through the shelter, you get smarter, you get wiser. It's impossible to change your life unless you have, I don't know, even with money. You can't change your life like that. And I give that example, having to leave today. So each time you leave, you get smarter, whether it's how you put laundry away. I learned to take a tampon apart and wrap a $20 bill around it and put it back in the paper and seal it just so. So if I'm sneaking out to leave, I grab a tampon. Most guys are going to go, "Oh, okay, I don't even want to see that." But
you got your money in
you learn all these little tricks that you do.
Do you have a workshop on tricks?
I mean, it's just
Yeah,
you go in a shelter, and the next time you know it's time to go, and you have no place to go, so you're going back to that relationship.
Well, it's interesting that you have to kind of almost manipulate your environment to get out of your environment, and I guess that's a part of
And
what
that's
happens.
a lot of work, the work on the hotline that does that.
Right.
So and I think that that's also part of trauma-informed care, because I think sometimes when we talk about the medical model, we talk about all these things, it's one prescription for all. And when we start shifting the way we view care into more trauma-informed, we say, okay, well, what is in this specific situation? Because maybe the tampon thing wouldn't have worked for someone, won't work for someone else. So what will work in your situation?
Okay.
What strengths do you have as a person that you're calling? First of all, you're calling, so you have some strengths, you're calling. And what can we do to build on that? The person that comes into St. Elizabeth's, what strengths do you have? Because you have a strength, you walked in the door. Where can we go from there?
And that empowerment is what made me the person that I am today. That person, when you call that hotline, I tell people all the time, call the hotline. They are going to give you a safety plan.
Yes.
You call that hotline. You were in panic. It takes opportunity. It's usually fear, something propelling you to do it, but and back when there's no cell phone, so you had to walk to that payphone. And sometimes it's in the middle of the night, sometimes it's your clothes on your back, and oh my God, if there's no space at the end,
Then what are you gonna do?
I got to go back home.
Yeah.
And 9 times out of 10, he's going to know that I left. At the iPledge, the speaker this year was the hotline worker. And I was a guest. And I'm sitting and I'm listening and I'm good. Sometimes I can tell my story and I'm good. Other times it takes me, I'm done. So I'm listening and she does a skit where the hardest part of her day, she wrote a poem, and the skit was, she's saying, "Hi, this is hotline number 99, and in the other voice she's saying, this is the victim and what's going on." And she said the hardest part of her day is saying there's no space. I was done. I was done from the rest of the day. I knew what that was like. I knew that desperation of finding a quarter or a dime back then for the payphone and leaving. Rain, snow, sleet, or hell, it's 3 o'clock in the morning. So it's courage and it's opportunity, and you call and you're saying, I can't go back. I can't go back in there. I can't do this. And they talk to you and they say, there's no space. And you have to go back. Or sometimes they'll say, we have some space at the Salvation Army or this place for one night. And you're standing there going, that's not going to do me any good.
True.
Because tomorrow I'm back in there and I'm going to pay.
For
I'm
being
gonna
out
pay
that
for
night.
this.
Yeah.
I'm going to pay for this.
Yeah.
So it is listening to that poem, I was out. I had a full day I'm on the phone. Not canceling that. I knew. I said, maybe I'll just go shoe shopping. Couldn't even do shoe shopping. I'm going home. I'm going to get me some takeout on the way. I'm going to go upstairs. I don't even watch TV, and I'm going to turn the TV on just to watch trash TV for the rest of it. But I knew I was done. I knew. I've learned that you're flatlined for the day. And it was just hearing her telling that and knowing that. I mean, I feel it now in my stomach, that desperation of making that phone call, and they're saying there's no space.
So there are things even today that trigger those old memories and experiences, which is actually what trauma is about, the triggering of those events. Do they get any easier to deal with as you get more?
I thought, I've told my story. I think I started initially telling my story because there's such shame that goes with it. So I started telling my story on my own. If I tell you, there's something that takes that shame away. I mention it first, so I lead with my story. Anybody that knows me knows that victim of domestic violence, I had 2 kids, lost 2 kids in that role. I mean, they know. My daughter, as a little child, at 2, knew my story. And that was to protect her from anyone that tried to, family can be lovely. Anyone, especially family, that tried to pollute her with, well, your mom did this, your mom did that, here's my story. And to break that cycle, to make sure it doesn't happen.
Sure.
It still triggers me.
Sure.
So I've always told it. When I first started doing volunteer work a couple years ago with Women Against Abuse, I testified with them with City Council in getting that second shelter open. We went to Harrisburg. And that was very, this is the second one. That was very empowering. And it was my family that said, when you do those outreaches, you're a little bit unbearable. What do you mean?
Really?
I mean, is he crazy? What are you talking about? No, not so much. So at some
What did
point,
they mean it was unbearable?
I was a little unbearable.
To them?
To them. Well, pretty much anyone that was around me.
Oh, I find your story actually helpful.
Right, but the re-traumatizing made me a little bit of a bear because I lived by that never again. What do you mean, do I want coffee? I asked for tea. What do you mean by that? And just seeing it everywhere, responding to it.
That hypervigilance that we were talking about.
Yeah,
the
it was,
hypervigilance, the
it was there. Like,
Yeah.
what do you mean peppermint? I didn't ask for peppermint. And seeing it everywhere. So it got to the point if I was doing an outreach, I had therapy the next day. And this was like 3 years ago. If I did an outreach, my therapist was the next day. And the therapist is saying, you can't do this outreach anymore.
Why? Because it was making you too...
Yeah, it's making me too crazy. No, that's what I pay you for. That's what I pay you for.
To make you sane.
Right. This makes me feel good. Makes me feel good. Yeah. I know if I do something, you're scheduled the next day, that's your job to fix that. But I'm not going to stop doing this because it means too much to me.
Well, a lot of people who watch the Tapestry shows, one of the things I constantly talk about, they're probably tired of hearing it, is it sounds to me like the old Jungian concept that you're humanizing your shadow. And in the humanizing of that shadow, that experience, the shadow becomes you're less vulnerable to the shadow. So actually, from where I'm sitting, one could say that reliving the event and telling your story and developing the resilience is exactly what's going to humanize that traumatic event and make it less difficult as time goes on. One would think.
It's been 35 years and I couldn't tell you. If I tell it, I can tell it. For 35 years, I never know. Usually I'm like this. A couple times I felt myself just in this setting getting a little emotional, and I just never know. I can tell it for 3 years in a row, and then at one time, it hits me.
Is it something that is discussed that triggers it, you think, or just the whole event?
It depends. I've told the same story for 35 years, and I couldn't tell you a Monday, a Tuesday, a morning, and afternoon what happened. There's no rhyme or reason. Wow. But I'm better at telling it now with less breakdowns, but it still happens, and that's what was surprising to me, that there's still
something there.
It's still something that 35 years, and it's probably 37 years now, that I'm still triggered by.
Well, if energy is circular in nature, it'll always be there.
Right.
If you believe that energy is linear, which I don't believe it is, I believe it has this kind of circularity to it, that you will always get an opportunity to deal with the event in a different way maybe, but it'll always be there. It never disappears because it's a part of your life events.
Right, right. And it was from probably 17 to,
Sure.
I remember waking up on my 25th birthday and feeling for the first time in my life that I was free. Even though the divorce was before then, but just feeling I was free. You know, the monkey was off my back. That when I got my divorce, I was so excited. I came out and just started walking, and before I knew it, I was home. And then I realized my car was still downtown.
Oh.
Because it was just this freedom. Like my feet weren't even touching the ground anymore. I was free. Even though I was out of the relationship, it was something about that process of the divorce and finalizing it that it was like a weight that was
Like a chapter in your life is
Right.
over.
Right.
You can move to another
Right.
space.
Right. And I was physically past that, but it was just that that process. You know, sometimes we need that process to kind of let you feel it.
You know, sometimes I can close my eyes and I could say to myself, gee, like post-traumatic stress disorder. I mean, you know, you hear, you know, when you look at the symptoms of trauma and you look at, you know, the experience that many people have had in the war and other areas, there's a lot of common elements to the experience.
You know, that's funny. For years, I described my experience as I felt like a POW. Just a lot of the things that
I, could
I
see
was
that.
denied. You can't eat, you can't smoke cigarettes. If I said you don't go to the bathroom today or you don't eat today, you don't happen. A couple of months ago, I was watching Senator McCain's story. It's on one of the educational channels on television, and I probably got 10 minutes into it and said, oh my God, I can't watch this. It was just bringing up too much.
Too much of the events.
Too much of the events in my life to even get past 10 minutes of it. I cannot watch any movies about domestic violence.
Oh, okay.
If I do, I have to make sure that it's in the morning, I have a restful day. So the movie with Tina Turner, I watched that and, you know, took me forever to get through it. But coming on TV, can't watch it. Just, it's kind of like a scary movie.
Sure.
Don't even watch it. It's,
Oh, yeah.
it's too traumatizing. Too traumatizing. And
Because of all the connections you make.
all
to
the
events.
connections, just
Yeah.
some of the physical brutality, some of the things that happen, it brings back your own flashbacks. So, no, I don't watch any domestic violence shows or programs. It's too triggering.
Yeah.
It's almost like I'm watching my life and I have flashbacks while I'm watching it. So at that point I'm going, okay, I can't do this.
So I assume these experiences you hear about, I mean, in the work that you do, and I mean, I assume you begin attacking it kind of through the physical and helping them move through that experience and the psychological. Now, one of my pet things is that where's the spirituality and the wellness and the wholeness come in? I can see, how do you connect that to wellness? I was kind of curious as to, do you do any of that?
Well, you know, I think that part of what you were saying is that I think the first step is to really acknowledge that your past, your trauma past, has had an effect on you physically and emotionally, and I think that that's one step that is lacking in some places, like
It's huge.
and in St. Elizabeth, that's what we try and do, so that when somebody comes in, maybe having seen the domestic violence movie and being re-triggered, they're not, and maybe they're a little irritable, they're not, non-compliant, or whatever it is, whatever symptom that is given as a result of that. And I think that connecting and making those connections within, again, that the way I look at spirituality and all of that is that it's a real strength within the person. So to make sure that that is something that is touched upon in whatever work you do with them, and make sure that they are using all their inner resources that they have, because they do have inner resources, and making sure that they're building on that instead of, oh, that's great that you go to church, that's nice. you keep on doing that. But no, really, like, how does it help you? And really addressing it, and how does it help you in terms of getting through, does it keep you grounded when you're having a flashback? Does it give you the strength to get through the next day if you have had a bad day and you're being re-triggered, and you need to make sure you get through the next 24 hours. So, really using it as a strength, and maybe that, that's something that, could always, you know, that can help the person versus something that is a side note. Oh, we're not going to really address that. We're not going to look at that, you know.
Yeah, and one of the things that we do at St. Elizabeth Wellness Center is we try to maintain connections with people. So we get people that come to us through the medical clinic, and if we identify a behavioral health need, we do that warm transfer to the therapist. And we have people that come to us through therapy, and the therapist identifies a physical need and then does the warm transfer back to the clinic. And there are people who we just are not sure they're okay, and maybe they're not talking about their situations, but we engage them by having them come back every week, or come back every week, you know, for your blood pressure check, or just to check with so-and-so. Some people use our lobby as just a hangout area where they come and just, they're just happy to come there and talk to somebody. And we encourage them to use the resources that they have. So, you know, for some people it may be involvement in a church. For some people, whatever higher being that makes them feel comfortable, we encourage them in that direction. Because we understand we cannot provide all the resources they need to keep them grounded.
Is it, I mean, I'm, again, just asking a question, really. Is it a part of what we sometimes refer to as their recovery plan or their treatment plan? It depends on, you know, your orientation. I mean, we tend in the person-first approach talk about recovery plans, and do they get in other words, is it something that as a part of wellness is brought up? I mean, what is your thoughts about spirituality as opposed to necessarily religion, although there is obviously spirituality in religion, and there is religion when sometimes doesn't seem to have a lot of spirituality in it. I mean, we could see that too. But I often wonder if in this fabric of this new place of wellness, that is there a significant, at least thought that you're going to move a part of your planning into a more integrated spiritual presence in the community. So not necessarily that you're going to be running groups, although I would say maybe that would be a good idea to run groups around spirituality and having people get connected, and whether that be to Judaism or Islam or Christianity or Buddhism or whatever. But you wonder if one believes that your spirituality drives your car eventually, then somehow in a wellness program, and I'm not saying you don't, I'm saying you do this, but I'm saying that you would see that it would be a part of their whole plan. And I was wondering if you feel that there's enough emphasis of that yet. I mean, I know you're new and you're evolving and things are occurring. And I wouldn't mind asking Renee if spirituality played a part in the exposure and experiences that she's had even up to today. Not that you have to answer right this instant, but we only have a few more minutes. But I was just curious what you think programmatically. Is that something that you think about more than maybe some other issues? I mean, you surely have a much more comprehensive plan than most places do, and you know, God bless you for that. I mean, I'm not arguing that at all, but I'm kind of curious, you know.
I agree with you that spirituality is really a basic need for everybody. There's a need for everybody to believe in something other than themselves, because as human beings we're limited. But having that ideal outside of yourself that you can believe in is very healing to you. And we don't have right now specific programs in that direction, but we encourage our patients, our clients, to really figure out for themselves what really helps them, what helps them get grounded. Is it their family? Is it their church group? Is it their dance group? Is it their biker group? And really connect with that. Because we have a lot of people that are depressed, or they are anxious, or they have, you know, other, you know, mental conditions that are very serious, but could be alleviated by some of this group involvement and belief in somebody other than yourself.
You mentioned dance. If you think of threads to your soul, you know, music, dance, art, they're all spaces that one lives in that really connects you. Because what are we? We're we're spiritual beings having a human experience. We're not human beings having a spiritual experience. And part of the transition from your physical space is to make sure that you realize your spiritual space. And when I think of wellness, I think of pieces of that being an integral part of the program. I believe that that happens in your facility. I'm not arguing it. But what I've noticed over the years is that many of the counselors that I deal with here and train, that if there's a lack of their understanding, it's not so much in the psychological or some of the social, there's a kind of lack in some cultural issues at times, but it's the sense of spirituality playing a role in your wellness. I don't know if you want to relate to that.
I mean, I grew up Christian, but at some point when this was going on in my life, I moved to a more spiritual place without religion. I did a lot of meditation back then. And I think with the meditation and with the empowerment that I got from Women Against Abuse, from having continuous contact with them, that was positive. It was about empowering me. And the meditation allowed me to kind of go to that quiet place within myself. Yeah. At some point, I went to a doctor who gave me for the stress Valium, and then I used that to try to kill myself. So decided, okay, no more pills. So I had to rely on meditation and other things to kind of get me to where I was kind of in my zen, so to speak, without using medication. Because I was afraid of pills after those kind of suicide attempts. But finding that and the empowerment, so I would say it was the empowerment that I got from Women Against Abuse, and the meditation. Yeah. Kind of helped me to get the strength to move on.
And I think that too, just to follow up with that, I think that from something that you mentioned earlier, the spiritual sense of sense of community, which I think at St. Elizabeth's, at Women Against Abuse, we try to really foster as much as possible. I mean, I know that we open up the space at St. Elizabeth's to the community to, you know, do whatever they need to do, hold meetings and things like that. And something that you had mentioned earlier, that when you came to the shelter, it was like, wow, like I'm not the only one. There's a community here.
Yeah, it is.
And the sense at the walk, which is a great event every October.
Right.
So it's
my niece came there. She felt the same thing. She was like, wow, this is magical.
Yeah,
really
and I think that magic, that sense of spirituality within a group is really helpful. And I think that that's one thing that, you know, we try to do with everybody. I think there's a great sense of empowerment. Yeah, it's a great sense of empowerment. I think it's a great sense of, oh, I'm not the only one, because a lot of times you think when you have been going through something traumatic, I'm the only one who's going through this, and then you leave and you go and you're like in a group and you're like, whoa, I'm not the only one. I'm not the only one who had this experience, and it's very freeing to know that you're not the only one, because you get a sense that, oh, it's only me who's ever been through
and
this.
Domestic violence has a lot of isolation in your partner.
Absolutely, that's part of the power and the control.
Isolate yourself. That's very powerful to have that.
Yeah,
that's a common element even in the general recovery movement. You know, the recovery walk that's been going on for quite a few years at the city. There's this sense of collective consciousness almost of the life event, and you meet people who share your experience and really help you get through.
Yeah. And moving forward, we are in about a month we're breaking ground to build a very large wellness center at the 21st block of Cecil B. Moore. So we're really looking forward to that, and 2015 we should be opening up that brand new facility.
That's a wonderful way to end this discussion with what's coming in the future. Well, that's all the time we have for today. I want to thank my guests, and I want to thank you for joining us today. You have been watching the Tapestry of Life on CCP TV, the educational channel of Community College of Philadelphia. I am Dr. Pascal Scoles, Professor of Behavioral Health and Human Services. See you next time.